Today we will not have a Facebook Live because of some technical issues. So those who are regularly watching our Facebook Lives, they may not able to watch this webinar on Facebook. Let's start with this webinar. I welcome Madam and Sir. Sir and Madam, we're delighted to have you both here on this platform. Again, Sir and Madam, I'm thankful for both of you. Let's start the session. I will give a brief introduction. After that, we can move forward. This is 25th webinar in lockdown period. The most effective way of communication is webinar series. Our sincere attempt from Sridhut Papeshwar Limited, bring scholars, eminent Vaidyas from field of Ayurveda in front of you to share the vast knowledge and expertise with all attendees. The eminent scholars need no introduction, and they are here to guide us in this regards, and their rich experience will enhance our direction to treat patient and will also touch on preventive aspect. Since 1872, Israel is known for authentic, standardized, safe and efficacious medicines. Siddhut Papeshwar Limited is always on forefront to share knowledge-based experience to all Vaidya Samuday. You must have already experienced our Rasashastra Sambhasha Vivek talk, Jyotishmati quiz, etc. Today we have invited two such eminent speakers for academicians as well as clinicians. Our speaker, welcome Madam once again, Dr. Shubhamangala Acharaya from Bengaluru. Let us introduce behalf of me. Madam, who comes from Ayurvedic facility background, studied BMS at SDM College of Ayurveda Hassan. She has immersed herself in the field of Ayurveda from past 20 plus years. She was in San Jose, California, US, where she was practicing Ayurveda from home after her marriage for a period of 4 years. For the past 15 years, she has been treating patients and has her own Panchakarma center set up in Uttarali area, Bengaluru. Her clinic is recognized as a Garbha Sanskara Kendra that provides consultancy for healthy progeny. She has done her yoga instructor course from SDl Bengaluru. She has been writing health and lifestyle related articles in leading Kannada newspaper and magazines like Taranga, Sudha, Tushara, Hosadigantha, etc. since 1998. She has also published several articles in the international online magazine, Hinduism Now. Today, Madam will guide us on Ayurvedic approach on Tamakshwas. I would like to request Madam, start your deliberation, start your presentation. Along with that, I'm requesting all attendees, you can write your questions bottom of your screen in chat section as well as question and answer section. So I'm requesting all of you, we can discuss this question and answers after webinar. Okay. Madam, please start your session.
Thank you very much. Thank you, Sridhut Papeshwar, for inviting me. I'm just a practitioner, not, but still you called me. It's an honor. So, okay, thank you. I will start sharing my screen. Thank you very much. Yeah, thank you. So I have selected this topic as I've seen more patients, so I'm more confident. So, and I have writing your product a lot. So I'm decided this. So before starting, my prayer to all the great Vaidyas, Ragadi Rogan Sadatan Shuktan, Sheshakaya, Prasatana Sheshan, Ausukya Moha, Daruchibdagaya, Yoga Purva Vaidyo, Manu Namostu Tasmai. So, so for my salutation to all the great Vaidyas and whoever has gathered here. So thank you very much for, and I'm telling whatever I'm discussing here, it's my experience, and it's not something exactly textbook reference or something. I refer books, but I don't follow exactly, and I use my own yukti. Maybe some people may find how this preparation can be used in this condition like that, but it is my experience and I'm finding the results. So I'm sharing whatever I have found. I'll share with you people. So the first Tamakshwas have taken, and Bangalore is known for Tamakshwas as we have cold and polluted weather here. And as Charaka and Sushruta, they have their definition like Vishesha Durdine Tamyeti Shwasa, Tamaka Shwasa, Sushruta says. The Durdina, and when the Durdina or a cloudy day, the person can't breathe. Tamyeti or blocks, or it's like Tamas is occupied to the Shwasa. So, and also according to Charaka, Tamascha so Shwasa, Tamaka Shwasa, Tamas or the block of the breathing. Shwasa comes in pathology as well as physiological form. And so Nidana, we can, I've just taken the textbook Nidana. We all know all these things can be compared to present day, like Rajasa, Dhuma, Vata, Bhyam, Shita, Sthana, Ambu Sevanat, Vyayamat, Gramya Dharmatva, Rukshan, Vishamashanat, Ama Pradoshan, Anaha, Draukshad, Ati Apatarpanat, Daurbalyan, Marmane Ghata, Dvandvacha Atiyogataha, Atisara Jwara Chardi, Pratishaya Kshatashayan, Raktapita उदावर्ताद् विसूच्य अलसकादपि पाण्डुरोगा विशेषाच्च प्रवर्तते गतविभो. So here Tamakashvasa as well as Hika, both they have given the same Nidana, as both are due to Vata. Vata Viloma is the main thing here, and Kapha involvement. So all these things like Raja Dhuma, we have pollution, we have bad weather, we have Shita Sthana and Shita Ambu Sevana, Ati Vyayama. We go, I mean, nowadays people use gym, and they, without each person has their own like their shakti, according to their shakti they should do exercise, but they do excessive or less, so both will affect. And Gramya Dharma, too much indulgence of sexual intercourse, and Ruksha Ahara, Vishama Ahara. And nowadays the eating ghee is a big it's like by it they have that cholesterol concept, which is not correct. So Ruksha Ahara is also common now. Vishamashana, eating, not eating in the time. And Ama Pradosha, Ama is the main cause for all the problems. Because of indigestion Ama happens. Ama and Anaha, Draukshyat, Ati Apatarpanat. And dieting is also one of the reason, Apatarpana. And Daurbalyad, Marmagata, any injuries. And Dvandva Atiyogit, both hot and cold, taking the hot and cold things immediately one after other, that is also one of the reason to get Tamakashvasa. And Atisara Jwara Achardi, these are all the conditions. We can say even they are like secondary Shwasa can take place by all these conditions. Pratishaya, Kshata, Kshaya, Raktapitta, Udavarta, Visuchaka, Alasaka, Panduroga. Pandu is one of the Shwasa condition, is also due to the Pandu. And Visha, these are all the Gada conditions from which Tamakashvasa Nidana, these are all the Nidana for Tamakashvasa. And also food, what are the food which Nishpava, Masha, Pinya, Katila, Taila, Nishevanat, Kapha and Vata, you can see in this. And nowadays many of the foods which we are not using like Pishta Shaluka, Pishtambi, Vidahi, Guru Bhojanat. So whatever food we eat, in that Guru and Vishtambi and also Ruksha, these are all the causes for Tamakashvasa. Jalaja, Anupa, Pishita, Dhadi and Amakshira. Amakshira means the not boiled, unboiled milk. Sevanat. Abhishandyad Upachara, Shleshma Chana, Savanat. Shleshma will increase in the body. Katorasya, Pratikha Bhakshate, Pratagvida. These are all the food factors. Vihara and Ahara, which cause the Tamakashvasa. Samprapti, Yada Sutram Srotasi Samruddhya, Martha Kapapurvaka, Vishwagvrajasi Samruddhyas, Tada Shvasan Karoti Sa. So the Samprapti is where dosha, vata and kapha are involved. Dushya, rasa, sama, ama is there. Srota, pranavaha, annavaha, udakavaha. Vagbhatta says it's amasha is the cause where the sthana of Tamakashvasa, and Pittasthana is also considered Amashayodbhava or Pittasthana. It's Abhyantara Roga Marga. So I made a how the Tamakashvasa takes place. Nidana, as I have mentioned previously, Nidana leads to Agnimandya and Kaphavata Dushti. From there, Ama formation and Vata Vilomata. Vata is cause for all the conditions. So like Pittam Pangu, Kafam Pangu. So when Vata goes Viloma, so Kapha is definitely blocked, and Sroto Avarodha is also then the Sruta Avarodha takes place. kapha vata, and pranavayu is the main involved vayu here. So kapha becomes avaraka, and avrata pranavayu, so it blocks the function of proper movement of pranavayu. Viloma gati takes place, so shwasa is the outcome of this samprapti. And purva rupa अनाः पार्श्वशूलं च पीडनं हृदयस्य च प्राणानां च विलोमस्य श्वासानां पूर्वलक्षणं. So purva, many time we can see like heaviness in the stomach. Agni mandya is the main cause. Agni mandya, when anaha state takes place, distension of abdomen and pain in the flanks or sides, and body pain and chest pain. Chest pain is due not due to hridaya, it is chest it like chest burn or chest pain due to gas. So all these are viloma gati of pranavayu leads to these conditions. Pranasya cha viloma. Also viloma of pranavayu leads to this condition. These are all the purva rupa lakshanas of tamakashvasa. Then by neglecting this, person will get the symptoms like pinasam tena rudho gurgurukam tatha ativa tivra vega shashvam cha shwasam pranam prapidakah प्रपीडकं प्रताम्यति वेगाश्च कासेन सन्निरुध्यते प्रमोहं कासमानाश्च स गच्छति मुहुर्मुहुर्. So pinasa will take place. Gurguru, that sound comes, and the person breathes heavily with a lot of he uses more energy because he can't get the, it's like gasping takes place, and khasa, severe cough will be there, and and sometimes he goes to pramoha or unconscious stage by coughing for a long time. And shleshmanya muchate brusham bhavati dukkitaha, and always be sad, or anxiety is the main symptoms in this tamakashvasa. Tasya eva cha vimokshante muhurtem labate sukha. When the phlegm is removed for a few minutes or for a muhurta, he'll feel comfortable. Again the problem starts. Ata tasya asya udbhavas tedam khantha kruchrat kroti bhashitam. So for speak he finds very difficult, and there is a block in his throat. And nidra, he will not sleep. If he sleeps also, it's very the increases, problem increases, and he has to get up. And parshve tasya avagrihy shayanasya samirana. If at all he sleeps, his parshva will accumulate, samirana or vayu will accumulate in his parshva, and he gets body pain and he has to get up. Asini labate saukyam ushnena abhinandati. That is upashaya anupashaya. Here upashaya is asina labate saukyam. He feels little comfortable by sitting posture, and ushna food and ushna jala, he feels comfortable. Uchritakshe lalate, and he always his eyes are protruded, and it's like it moved upward, his eyeballs like moved upward. Sudyatha brishat amitam vishushkasya muhur shwaso. Breathing many times, and it's all gasping, or and vishushka asya, his always he'll have dryness of mouth. So these are all the symptoms we can see. Many some of the symptoms are, if in the severe condition, all the symptoms can be seen in the patients with the asthma condition. And it anupashaya is mega ambu ambu, cold water, or maybe rain, and cloudy day, and exposed to wind. And shleshmascha vivardhate, by shleshmaja ahara. All these things are increasing factors, anupashaya for tamakashvasa. Yapya and Sajya Sarita is also covered here. When the condition increases, if it is a chronic and if it is there for long time, it can be considered as yapya. And nava, or new condition, especially in children, if it is newly developed, and it can be sadhya. So I've seen the results. I've seen the children, it can be easily corrected. And as the person suffers for long time and they come the old age, it can be controlled. Very rarely it can be cured, but mostly it can be controlled, and patient will stay healthy. Once in a while he'll get symptoms, but not in the severe form. After treatment, we can give them their rasayana therapy, and immunity can be improved. By this, patient can happily survive, but rarely he will get the problem. And Pratamaka and Santamaka are mentioned here. So Pratamaka and Santamaka are the conditions from, it happens from Tamakshwasa. If a person gets fever and burning sensation, daha, jwara, all the pittaja symptoms, it is Pratamaka. And here he needs cold, fermentation, and cold water, intake of cold water leads to, he feels comfortable by taking cold. And Santamaka is also one of the same condition where Vegavarodha and exposure to Dhuma, Raja, and again the symptom increases. So this is Pratamaka and Santamaka comes under this Tamaka Shwasa only. Next, Chikitsa Sutra. Here Kafadike Balasyecha, Vamanam Savirechanam, Kuryat Patyashino Dhumam, Lehadish Shamanam Tataha. Where Kafadike Bala, which is very, we can see few cases where Kafadika and Bala both will be there. And for them, Vamana Virechana, Panchakarma is suggested, Shodhana is recommended. For persons with Vata, Ativata, and for children, which is not possible. So after Vamana Virechana, for them Patya and Dhuma, Leha, like Rasayana therapy is recommended. And Vatikan, Durbalan, Balan, Vriddascha, Anila Sudanehi, Tarpayet, Shamani, Sneha, Yusha, Rasadibihi. So mostly we get these conditions. In my clinic, I have seen Vatikan, Durbalan, Balan. Many come with lot of treatment. They go emaciated, or Krishata is a common condition, and Vata Vriddhi Lakshanas can be seen. There'll be Durbala, and most of my patients are, more than half of my patients are Bala, so whom we cannot treat with the Panchakarma or Shodhana. Only Sadhyo Vamana can be done, and Vriddha also, which is not possible. Anila Sudhanaihe, and these people we should give Shamana line of treatment, and Rasayana therapy is recommended for them. And here Rogi Pariksha, when the patient comes, we as Ayurveda Vaidyas, instead of too many investigations, I follow Prakriti, Vikriti, all these things. We get clear reference only for differential diagnosis. Sometimes when we get confused with no phlegm, and still the person will be having a lot of breathlessness. Sometimes we have to differentiate between whether it is cardiac, asthma, or some other condition is there secondary to other disease if he's having any breathlessness. Otherwise, mostly we can see the phlegm, we can see protruded eyes and sunken, all the symptoms by seeing the patient. We can diagnosis. We don't have to have too many tests. Just blood tests, we can go for it, like hemoglobin and Panduta, or any other conditions there are allergic conditions, go for blood test. I don't many times I don't write any test. So Prakriti, Vikriti, Sara, Samhamana, we can see, and to decide the treatment, these are all the important things we have to see. And anxiety, breathing, and any skin allergies, sometimes we have to check, and we have to find out any medicines also. Even our medicines sometimes it may cause the allergy, so we have to take a clear history. So Darshana and Sparshana by auscultation and Nadi Pariksha. Kaphavata we get in the Nadi, and auscultation, any wheeze or anything can be heard. Even heartbeats, we can see, find out any enlargement of heart. It's very difficult by auscultation. Still, changes in the heart can also be diagnosed. Prashna is the most important part. I follow mostly Prashna because history is very important, where how it started, when, all, sometimes even Abhigata, Bhaya, Shoka, all these things are the cause. One of my patients, she was fine before that. She is a Kapha Prakriti person, but her asthma developed after death of her son. So since 5 years she had the problem. So for her, I had to concentrate more on her mental condition than her actual asthma. So for instead of asthma, I can say Tamakshwas, because I don't know exactly whether we can say the same, but I just follow Tamakshwasa diagnosis treatment. So history is very important, and also like their native place, and when they move to this place, sometimes they get the problem after moving to the place where they are staying now, or sometimes they will be having the problem before, and after going leaving the place won't be any problem. So all these things, and their food, their lifestyle, sometimes by correcting these things, half of the problem will be solved. So Prashna or history taking is very important. Along with that, Kala, Satmya, Vaya, everything we have to find out. Investigations, as I said, blood test, chest X-ray can be done, ECG, just to differentiate pulmonary function test can be done, but I don't do too many tests. Um, and line of treatment, what I follow. So Shodhana, as I said earlier, Shodhana is not much used in my center. Vamana I do. I have given hardly very few because Balavan Rogi with the Kapha are youngsters who are very busy. I tell them every time to go for they just postpone it. Virechana can be done. They agree for Virechana. But Vamana, I don't know, maybe in my cases, my patients, or I don't know why, they just postpone. They, by hearing the procedure only, they feel not very comfortable. So very few cases I have done Vamana, but the results, beautiful results. And that one lady, she was in beginning I don't, because they need to have a Bishak is very important before advising any of these treatment. And first of all, they don't have no idea what is happening, what kind of treatment we give. So whatever panchakarma we say, they think we are doing some massage. So I have to explain to them. So in the beginning, if we give proper shamana ushadi and they get some results, and then we can suggest them for permanent reliefs, we can ask them to select the Vamana. So Vamana gives very good results, especially with the Tamakshwas and allergic condition. Some people will have rashes on the body. So both are best treatment is considered as Vamana. For the I have very few cases, and Virechana I have done just Virechana, not after Vamana. So Virechana people have agreed, and especially if I say you lose weight along with your problem, they happily undergo Virechana. So detox means they think Virechana is fine for the condition. So Virechana has given the result, but mostly I have given Sadhya Vamana. What happens once we start the treatment for this bronchial asthma or this Tamakshwasa, and if they come from the after taking allopathic medicines, definitely the phlegm will be settled somewhere, like hard phlegm formation will be there. Once we start our Deepana Pachana and this Kafahara Dravyas, which are Ushna, Virya, and they are like they suddenly the kapha starts diluting, and the people get kapha, cough, more phlegm. So they start calling, see, ma'am, after starting your treatment, we are getting our symptoms have increased, our problem is increasing, Ayurveda is not suiting all these things. So that time Sadhya Vamana works very well. I tell them to explain to them how it is like a snow mountain. When sun rays starts, then the mountain, the snow starts dissolving, same way your phlegm is dissolving, and that is the reason why you are getting this problem. So I explain to them, and I tell them, I give them this Fanta of Madhuyashti, and it is not very bad, so taste also okay. So I tell them to early morning have Madhuyashti Fanta, and they'll have some 4 5 Vamana like that. That will help them a lot. I've seen many patients with the Sadhya Vamana, they do it at home only. They don't have to take all the precautionary methods and Abhyanga Gritapana. So that will help them, immediate relief will be there. Then again I'll continue with my treatment. So Sadhya Vamana for children also, many children I have given. So for them, this once the what the same way when this Shleshma Utklesha happens, I tell them to have this Lamana Taila massage to the chest and back, and whatever has to be explained in our text, same way we follow. And just Utklesha just stimulate the throat, and they'll throw up. And it many like too many of my patients told after that they stopped even taking that whatever the inhaler they use, everything they stopped after this Sadhya Vamana, because it cleanses properly. Next time whenever they get too much of cough, they'll just vomit everything out. So this is the Shodhana procedure I follow in my center, not too many Vamana Virechana I have done. And Shamana line of treatment, usually generally I give Amapachana and Kafahara Vatanulomana. It's for all my patients. After once the condition comes to control, I start with Rasayana, whatever textbook has mentioned, explained, same way in my own method. And but specifically, some people have more Vataja, more like maybe their Prakriti or something like Vata is more, or Pitta, Kapha, I'll see. And mostly I get heterogenic conditions because after taking a long term, the steroid, they take this Daraphyllin tablets, injection, and different medicines, they will be having too many side effects. And first thing we have to treat the side effect. According to the side effect, I'll start the treatment for these conditions. As I told, I get 30% of my patients are Durbala and above 50. So not I can't give them Panchakarma, and Bala 50, only 20%. With that, I'm managing the Shodhana. Shamana, Amapachana, any Amapachana Dravya can be given. I usually give Vaishvanar Churna or Hingvachadi, Hingvashtaka Churna, depending on. I don't suggest different, even the tablet form it is available. So I try to give them in the tablet. Most of them are working and they are busy and school going, so tablet form is better. Or I mix all the Vatanulomana, Deepana Pachana, all the dravyas together, make a powder, and tell them to have muhur muhur. As we know, the for kasa and shwasa, muhur muhur is mentioned. So muhur muhur at least 4 times a day. If children come home around 4 o'clock or 3 o'clock, I tell them to take once before morning, before going to school. If possible, even in the afternoon, if they have the facility, if they can carry it and like mixing with honey and give it to the school lunchtime, they can have. Some children do that. And night before going to bed is very important. So like 4 times minimum they have to take the medicines, so that will help faster. And that's why even we should tell them that sometimes the symptoms may increase in the beginning. We should not worry, because they immediately they call telling that your medicine is not working, Ayurveda won't suit, all these things they have in their mind. And Kafahara and Vatan Lomana are mainly which we have to follow. Amapachana, and later this Trikatu Churna, Talisadi Churna, Dhanvantri Gulika. I just use like 10 to 12 Dhanvantri Gulika, pound it, make a powder, and add to this, or Shwasananda, depending on the condition. If the person is having severe condition and strong, we use more Shwasananda, Shwasakutara, like that. Otherwise, simple Trikatu, Dhanvantri Gulika, and Talisadi Churna, simple medicines. And even if more Vata aggravation or allergic factor is there, Haridra Khanda can also be used. Depending on the condition, I make combination. Dashimula, Rishta, Pushkara, even medicines like syrup, asavas, I mix and give them one asava and one churna, mostly is my prescription. So mixing all the churnas in one. And I don't know whether it is a correct procedure or wrong, but I'm finding the results. So because they can't take too many medicines, many people don't come to Ayurveda because they think we give too many medicines and we advise too much of patya. So that have to we have to remove from their mind. But some things we have to give. We cannot tell them that one tablet will work or something. So I make two types of one kashaya, and later I start with the lehya. And for different doshas, if vata if person is vata prakriti, then dashimularishta is more. I add more dashimularishta and yashtimadu and talisadi churna, because they'll be having dry cough and continuous. Even talisadi tablet form can also be there. This Dudpapeshwar, they are making talisadi tablets. I tell them to keep it in your bag, and whenever you get cough, you can chew it. So, and for pitta conditions, lagusut shekar rasa, they have sneezing, they have rashes sometimes. And pravala basma, guduchi satwa, esti churna, sitopaladi churna also, because some asthma patients will have burning feet, burning hands, and even burning eyes. For them, sitopaladi helps. Avipatikara and Punarnamadi Kashaya is the best. It rejuvenates the lungs. Even I had a heterogenic a patient with cystic fibrosis. Because of the chemotherapy, he had a part of his lung was had fibrosed. So for him, almost 6 months he took Punarnamadi Kashaya, and his cough, that whatever symptoms have reduced, even that whatever the fibrosis has happened, it got changed to normal lung. His lungs are normal now. So it's a beautiful medicine. I write Purnamadi Kashaya in many conditions, even Purnarnama Churna and I add in some medicines. So for Kafaja, we Abrakabasma, Shringabasma, expectorant I add more. If a person has too much of Kapha and he is Stula and his nature is self Kapha Prakriti, so we can give stronger medicines because Kapha Prakriti and Kapha the condition. So Pushkaramulasava, Karpuradi Churna is also good expectorant. The nitrogenic, as I said before earlier, they have mouth ulcer, they have different problems because of the medicines. By seeing the condition, we have to decide. We have to first treat the side effects. We have to correct their agni. Agni will be in very bad condition, no appetite at all, full of gas. So all these are because of the treatment. So first we have to correct those conditions. We should tell them, so explain to them this is the condition, first we have to correct, then slowly definitely whatever medicines we give, your that's Tamakshwas comes to control. So like this I treat in heterogenic conditions. So Avipatikara Churna, it's at a Vishahara, so toxins should be removed from the body, then our medicines start working. So Haritaki is also one of the thing I give for heterogenic condition. Shankhavati, Dashamula Kashaya, Khadiradivati, Punarnavadi Kashaya again. All these are according to symptoms I give. And Rasayana. For children, after once it comes to control, they say we have no cold, no cough. Very rarely we get running nose. Then I start the Rasayana treatment. I tell them at least 3 months to 6 months they have to take. If in the cold season starts, I tell them before next year when the cold starts, you have to come and take the medicine. Otherwise, they think, okay, now we are fine, we have no problem. Maybe some children have never come back after 3-4 years. They came for some other reason. They said, no, we didn't have any problem. But some children will have some problem. So we have to be prepared, because every day they exposed to this pollution. Even in school, they sit in front of board and so much of crowd and all. Many children are sick. They be taking antibiotics and different medicines, and they exposed to those things. So the chances of getting cold is there. But our medicines will work beautifully, and especially gold preparations. So I give Swamala compound of this Sri Dut Papeshwar Limited very regularly, and Agastya Rasayana, Chavanprakash, depending on the if severe still the phlegm is more, I write Talisapatra Leham of Kotakal. So depending. And for adults, along with this Dashmula Haritaki or this Kashwas Harirasa, it's a beautiful medicine. Because many people, I tell them to stop after some time, but they say we enjoy it. No asthma, no cold, nothing. So we have to, I'm worried, but they are not worried. They take Kashwas Harirasa regularly. I tell them to stop after 45 days as Rasaushadi, but they don't listen to me. Till now I haven't find any problem. But many are coming, and as it is lockdown has started, 2-3 people came yesterday, day before yesterday, collected some 4-5 pieces and went. So like this medicine is beautiful. So I have selected this subject because of these medicines. uh, so all these are Rasayana treatment. And mainly anxiety, many of them are having because of the problem. Some people are having anxiety, especially children. They can't play, they go out, they start playing, and breathlessness starts, and they feel very sad. And this for this anxiety, even we can add to the Shmularishta, we can add Saraswatarishta. I do that for children. I add Saraswatarishta, which keeps them little their mind calm. And we have to give them some time. We have to talk to them. Any patient, we need, as a Ayurveda Vaidya, we should it's our duty to convince them and tell them this is not a big deal. People are suffering, I mean, worse situations are there, we are better. So we should give them some counseling so that they feel comfortable. Otherwise, they get, even in schools, children are teasing them, they can't go outside and play for longer duration, they can't eat so many things. Patya is also very important. We tell them strictly not to take anything from the fridge. That is the main thing. And late dinner and eating ice cream or fruits at night before going to bed, which causes again ama and kapha vriddhi. So these are we have to be very strict. We should tell them, if you have to stay healthy, you have to avoid. Still they eat and they come after some time. This is a common condition. But many children, after suffering, they realize and they stop taking all these things. We just tell them, take now, you stop, then you can take any time once you are fine. If you want to take it now, then you can't take in future. Then they'll agree, and so we have to convince the as a Ayurveda Vaidya, and we should take us. I mean, I feel like many conditions where Ayurveda can give better results. So we have to select those diseases, and and if we start treating that those conditions, we get better results, and I feel we get more patients because they don't get proper treatment there, so they come to us. Even nowadays, this COVID condition, all these are rasayana. I think if we give all these things, definitely we get better results. I don't know what is going to happen. And yoga and pranayama, in the beginning, if the condition is severe, all this nothing can be done. Once the condition comes to control, slowly we can tell them to do these asanas where the chest is expanded, and proper this breathing is very important. Some people do many asanas, but they don't concentrate on their breathing. So inhalation exhalation is very important during these asanas. So following these asanas will improve the circulation to the lungs and muscles, chest muscles. And so these asanas like Baddha Konasana, Dhanurasana, Gomukhasana, Ushtrasana, Setubandhasana, etc., these asanas will help in improving the strength, lung capacity. And pranayama in the beginning is not at all possible. As we know, it is the one, it gives strength to the proper imbalance to the pranavayu. So slowly, once the disease comes to control, we can advise them to go for the pranayama. Slowly we can they can do the pranayama, starting with the kapalbhati, then slowly this nadi shuddhi or anulom vilom they can develop. Slowly they can increase the time, and definitely they'll be it will be helpful for them. And patya, I told whatever the food before, same thing is written here. So annavarga, now present day is hot food and no fridge items, and shleshma hara, and mostly people eat pizza and all these things they eat at night time where the agni is low, and they'll have these problems. So those food timing is also very important. And shakahari tavi, patola jivanti, lashuna haridra, ardraka, palandu, and phala varga, these phala are mentioned, dugdha varga, aja dugdha grita, and boiled milk. And every, I tell most of my patients have water, add turmeric to the water, boil it, then add the milk and drink before going to bed. That will help a lot. And even mamsa varga, jangala rasam, mamsa titira lava, which is not possible now. Peya Ushna Jala, even present situation. So we should adjust we should advise everyone to have Ushna Jala with even they can have some kashaya with jeera and with coriander, and boil it, and they can have this water, hot water, madhu, arishta, gomutra, sviraka, and vihara, pranayama, Ushna Snana, and avagaha, sveda, abhyanga, medicated, dhumapana is also advised. Apatya is also mentioned previously. These are all the things: ruksha, guru, vishtambi, ahara, and kadali phala, apakva, kushmanda, dadi, unboiled milk. Dadi is also, many people they eat dadi every day, and it's very difficult to convince them. Dadi is they think dadi is nutritious. So at night also, they, especially places like Bangalore, very cold weather, and still they eat dadi at night, which causes the problem. Matsya, Anupamamsa, and Shita Jala. Fridge water is also common condition. We try to follow the Western, and this is the from this we learned in all these troubles. Shaka Varga, Tikta Shaka, and Sura Asava are also mentioned. Okay, this is what whatever I have giving. I've made a PowerPoint, and I followed this. So any questions, anything you can ask. If I know the answer, I will reply. Shall I stop sharing the screen?
Yes, you can stop, madam.
Yes, thank you very much.
Okay, very valuable, insightful presentation, madam. Your personal experience as well as your classical experience you have explained. I think along with this, we have another speaker, Dr. Sanjay Kumar Singh with us. Let me introduce sir. Dr. Sanjay Kumar Singh has completed BMS from Kanpur University in 1993 and MS in Shalya Tantra from BHU in 2003. Currently, he is working as assistant professor in Department of Shalya Tantra and Bundelkhand Government Ayurvedic College and Hospital. Jasi sir is having more than 16 years of teaching experience. Dr. Sanjay Kumar Singh has published more than 18 scientific publications in national and international journals. Sir is pioneer in digital proctoscopy. He has developed digital proctoscopy technology with webcam, and still till now more than 250 digital proctoscopy done since 24th April 2015. Sir has also published a book named Chotiwala's Notes for PG entrance test. Sir has received Uddhav Das Mehta Chikitsa Seva Sanman in 2008. Rajya Stariya Sanman given by Rajya Stariya Dhanvantari Jayanti Samaroh Samiti, formed by Uddhav Das Mehta Samiti Nyas, Bhopal, Madhya Pradesh, and gold medal awarded by Institute of Indian Medicine, Pune, for research dissertation in the field of Ayurveda today's. Dr. Sanjay Kumar Singh is going to speak on topic of anorectal disease and its effect on immunity. Before that, I would like to tell all attendees they can keep their question ready. We can discuss. They can write below in the chat section or in the section of question and answer. We will discuss at the end of webinar. Requesting you, sir, to start your session, sir, please. Sir, please unmute yourself.
Thank you, Abhijit. Wait a minute. Is it coming?
Sir, it will come.
Okay. Yeah.
Yes, sir.
My topic is anorectal disease may affect on immunity. मैंने ये जो टॉपिक चूज किया है, मेरा थोड़ा हिंदी और इंग्लिश थोड़ा मिक्स चलेगा?
No problem, sir. You can continue in Hindi also. No problem. Hindi, English, whatever.
Right. तो हर एक व्यक्ति की इच्छा होती है कि वो उसकी प्राण इच्छा, धन इच्छा और परलोक इच्छा, लेकिन इस समय जो है, जो कोरोना काल चल रहा है, इसमें अब डिजास्टर की वजह से सब लोग परेशान हैं। 1,36,00,000 से ज्यादा रोगी हो चुके हैं कोरोना की वजह से, और भारत में भी अपना प्रसार कर रहा है और बढ़ता जा रहा है। हालांकि इसका जो रिकवरी की रेट है वो अच्छा है, और लेकिन जैसे आज की डेट का लास्ट डाटा था आज सुबह का, 9,70,000 पर्सन जो है इसमें अफेक्टेड हो चुके हैं, और 6,00,000 जो है अराउंड 13,000 जो है वो रिकवर हो चुके हैं। लेकिन इससे जो कॉमन सिम्टम्स बताए जा रहे हैं ये रेस्पिरेटरी ट्रैक से रिलेटेड है। मैडम ने बहुत सारा अच्छा बताया रेस्पिरेटरी ट्रैक के ऊपर। जो स्टडी कह रही है उससे मेल पर्सन जो है वो ज्यादा अफेक्टेड होते हैं और उनकी डेथ भी रेट भी ज्यादा है। और यहाँ पर जो सेक्स रेशियो में देखने को जो मिलता है मेल फीमेल, तो दुगने का लगभग है कि मेल ज्यादा 2:1 का रेशियो है जिसमें मेल जो है अफेक्टेड हो रहे हैं। और जो अगर एज रेशियो भी देखें तो जिसमें यंगस्टर्स और ओल्ड एज में थोड़ा सा ही डिफरेंस है। जो 18 से लेकर 70 मतलब ऐसी कोई एज नहीं बची है जिसमें ये कोरोना वायरस नहीं हो रहा हो। और इंडिया में भी यही रेशियो चल रहा है जो वर्ल्ड वाइड था, यहाँ पे भी मेल रेशियो ज्यादा है फीमेल के अपेक्षा। और जो एवरेज एज रेशियो है ये जो देखने को मिलता है कि जो यंगस्टर्स हैं वो ज्यादा इफेक्टिव इस पर देखने को मिल रहे हैं। जो डिसीज साथ में बताई जाती है उसमें कहा जाता है कि ये हाइपरटेंशन, कार्डियोवास्कुलर, डायबिटीज, मैलिग्नेंसी, सेरेब्रोवास्कुलर सीबीओडी, किडनी डिजीज आल्सो देखने को मिली है इसमें। और ये भी कहा जा रहा है कि इसकी संभावना बन रही है कि ये ओको फीकल ओरल ट्रांसमिशन होने की भी संभावना हो रही है। और जैसा कि इसमें बताया जा रहा है कि कुछ लोग क्लिनिकली जो है नेगेटिव है, लेकिन उनका जो फीकल मैटर है उसमें वो पॉजिटिव मिल रहे हैं, रेस्पिरेटरी ट्रैक्ट नहीं मिल रहे, लेकिन जो है फीकल उनको जीआईटी के लक्षण मिल रहे हैं, डायरिया, नोजिया, वोमिटिंग वगैरह उसमें देखने को मिल रही है। हमारे आयुर्वेद में कुछ ऐसी डिजीज बताई गई हैं जो महारोग से जिनको महारोग कहा गया, जैसे बात व्याधि, प्रमेह, कुष्ठ, अश, भगंदर, अश्मरी, मूड गर्भ, उदर रोग, ये 8 महारोग बताए गए हैं। और इनमें से देखें जो हमारा जो अभी इस समय कोविड में जो चल रहा है, तो कुछ डिसीज ऐसी हैं जो इसके अंतर्गत आती हैं, और ये कहा जा रहा है कि इन डिसीज की वजह से इम्यूनिटी लो होती है। तो यहाँ पे हमारे आयुर्वेद के अनुसार जो भगंदर और अर्श ऐसी जो जीआईटी से रिलेटेड डिसीज है, नेचुरली उसमें भी इम्यूनिटी कुछ कम होने की संभावना हो सकती है, क्योंकि इसका इतना बड़ा जो डाटा इस समय मिल रहा है कि मेल टू फीमेल रेशियो बहुत ज्यादा है, मेल ज्यादा है फीमेल कंपेरेटिव के। तो उसमें मैं मेरे कुछ डाटा मैंने कलेक्ट किया है, तो वो बताना चाह रहा था, शेयर करना चाहता हूँ आप लोगों के साथ में। यहाँ पे जो हमारे हम लोग देखते हैं तो एनल डिसऑर्डर्स में पाइल्स, एब्सेस, फिस्टुला, एनल फिशर्स, कोलाइटिस, कोराइटिस, एनआई, कोडेलाबिटा, कुबिटा, इनकॉन्टिनेंस, प्रोलैप्स, एड्स, कैंसर, ये सब चीजें एनोरेक्टल डिसऑर्डर्स हम लोगों को कॉमनली देखने को मिलते हैं, जिसमें हेमराइड की जो रेशियो परसेंटेज है वो सबसे ज्यादा देखने को मिलता है। इवन 52% जो मेल से जो एनोरेक्टल की क्लिनिक्स आती है उसमें सबसे ज्यादा ये देखने को मिलता है। उसके बाद एब्सेस आ जाते हैं, and then fistula and anal cancers, purulent ani, ulcerative colitis, homosexuality से related disease देखने को मिलती है। और इनके जो डाटा फैक्ट है, इससे देखने से पता लगता है कि जो एनोरेक्टल डिसऑर्डर्स हैं, मेल ज्यादा अफेक्टेड होते हैं, and may be found in all age group। और ये एनल डिसऑर्डर मोस्टली स्टार्टेड फ्रॉम 20 टू एज ऑफ 20, और ये जो पीक वैल्यू रहती है 45 टू 65 ईयर्स, उसके बाद में डिक्लाइन करने लगती है। और बताया जाता है कि एज ऑफ 50% मेल जो है या और पॉपुलेशन जो है वो पाइल्स या एमराइड से ग्रसित हो सकती है। इवन 75% पीपल्स लाइफ में कभी ना कभी एमराइड से रिलेटेड होते हैं, और ये चीज लोग अधिकतर छुपा जाते हैं और देखते हैं कि ओटीसी से दवाई ले रहे होते हैं, खा लेते हैं, और उनको पता भी नहीं होता कि क्या हो रहा है। और जैसे हेमोरॉइड है, उसके जो कारण बताए जाते हैं, दैट इज sexual relationship, chronic constipation, chronic diarrhea, lift heavy weight, obesity, overweight, pregnancy, sitting for long time, straining, ये कुछ बताए जाते हैं मॉडर्न के अनुसार। आयुर्वेद में भी चरक ने बहुत सारी चीजें इसके बारे में बताई जो हम लोग चरक संहिता में देखते हैं। इसके लिए बहुत ज्यादा डिटेल में जाने की जरूरत नहीं है। इसी तरह उन्होंने वातज, पित्तज, कफज के जो लक्षण है वो सब उन्होंने बताए। यहाँ पे मैं सुश्रुत के आपको कोट करना चाहता हूँ कि सुश्रुत ने बड़ा कंसाइज ढंग से उन्होंने बताया, और जो मेन फैक्टर्स है पाइल्स होने के वो उन्होंने बताए। विरोध, अध्यसन, स्त्रीपसन, उत्कटासन, प्रस्त्यान, और तणकाष्ठ, लोस्ट, वस्त्र आदि का ठंडे गर्म को लगाना, इनसे, और वेग विदारण, इनमें से जो जरूरी नहीं कि हर कोई व्यक्ति ये सब यूज करता हो, लेकिन स्त्रीपसन, उत्कटासन और अभ्यंग ये हर एक व्यक्ति यूज करता है। इवन आज की डेट में तो विरोधासन, हम लोग जंक फूड खाते हैं, तो ये सब कारण जो है पाइल्स होने के लिए रेस्पॉन्सिबल होते हैं। क्या ऐसा नहीं कि ये भी यही कारण, और हम लोग जानते हैं कि ये सारे कारण जो है इम्यूनिटी को भी हमारी हैम्पर करते हैं। जैसे कि विरोधासन इन्फ्लामेशन करता है, जीआईटी का, इंटेस्टाइनल मुकोसा कंजेशन, स्ट्रंगुलेशन ब्लड वेसल्स, एक्सपोजर टू ब्लड वेसल्स, ये इसमें हो जाता है। और उसके बाद बल्जिंग ऑफ ब्लड वेसल एडहेरेंट टू कुशन, एनल कुशन थ्रू द एनल मेम्ब्रेन। इसी तरह अध्यसन, अनसन, एक्सेसिव और एक्सेसिव डाइट, लो फाइबर डाइट, जंक फूड, कंजप्शन ऑफ फूड, नॉन वेजिटेरियन आइटम्स, मटन, फिश, चिकन, ये क्या करते हैं, एक्यूमुलेशन ऑफ मल इन एक्सेस में और लेस अमाउंट में, और इसके निकालने के लिए एक्सेसिव स्ट्रेन करना पड़ता है। और बिकॉज ऑफ दैट जो है प्रेशर ऑन द म्यूकस ऑफ इंटरनल ओपनिंग ऑफ द एनस अबव एंड एट द जंक्शन, that cause inflammation of the intestine and anal mucosa and congestion, strangulation on the blood vessels, and that leads to exposure to blood vessels, and then again the bulging of the blood vessels. Another pathology, the application of rush dravya, just like a prust, yarn, horse ridings, this cause a trauma on the external opening of the anus and rectal fossa and buttock skin, that leads to inflammation of perineum and perianal area, and that blood circulation move to inflammation area deprived at the anal mucosa. Again, necrosis of anal mucosa and the absorption of anal secretion, latent exposure of the blood vessel and bulging the blood vessels make the piles. Another, sexual activities. It is very important. Most of the persons, male or female, both are there involved in sexual activities. Vega and vague dharana leads to excessive contraction of sphincters of anal muscles and urethral muscles as well. That it leads to transition ischemia and necrosis in anal mucosa and absorption of anal cushion leads to exposure of blood vessel and then bulging of the blood vessel with adherent the anal cushion through the mucous membrane. And another cause is that is utkatasana, relaxation of in which sitting postures, sweating, relaxation of anorectal sphincters, and the relaxation of the anal mucosa canal, enough space for dilatation of anorectal vessels, and that leads to blood vessels bulging, and that leads to arts. This is the classical presentation of the सुसु संहिता में जो दिया है उसको आर्ट्स की. और ये जो कारण होते हैं ये एनल कैनाल की एनाटोमी है ये, और इसमें आप देख सकते हैं कि अलग ये इंटरनल स्फिंक्टर्स है, ये एक्सटर्नल स्फिंक्टर्स है, ये कॉलम ऑर्गलाइन है या रेक्टम है. यहाँ पे अलग अलग फोर्स जो है उसको करते हैं. ऊपर से फीकल मैटर आ रहा है, इरिटेट मैटर आ रहा है, नीचे से प्रेशर जा रहा है, इधर से जो है कि स्फिंक्टर्स के ऊपर कॉन्ट्रैक्शन हो रहा है ड्यूरिंग सेक्स, वॉल्यूंटरी यूरिनेशन ऑफ दिस, है ना. Because of that ischemia of anal mucosa and exposure of the blood vessels and anal glands देखने को मिलता है. And this form the colitis, prolapse, hemorrhoid, proctitis, fissure. These are the formations of disease occurs. And in the case of fistula, same, the external factors, injury on the buttock may lead to perineal abscess and further development of fistula. Other end factor for internal pathology, just like necrosis of anal mucosa, then reabsorptions of supporting tissue, anal glands exposure, and dilatation of anal glands, fecal matter impacting, and cryptoglandular infections, and that leads to perineal abscess or further development of fistula. These are the classical examples of our RVR and production of disease. And because this is the inflammation setup is there, and because of inflammation setup, as modern science says, there is a lot of complements secretes, and these complements further produce a number of diseases. And according to Ayurveda, कुपिता महिदोषाणाम शरीरम परिधावते यद संग कैवगुण्यात आदि तत्व विराजते. तो जो हमारे जो हम लोग फैक्टर्स ले रहे हैं, निदान ले रहे हैं, कर रहे हैं, उनसे जो दोष ये इन्फ्लामेटरी प्रोडक्ट्स हैं, जैसे शरीर में जहां जहां पहुंच रहे हैं वहां वहां वो पूर्व रूप पैदा करते हैं. और ये पूर्व रूप अगेन हमारे शरीर की इम्यूनिटी को हैम्पर करने में सहायक सिद्ध होते हैं. जैसे कि पूर्व में देखा जाता है कि अनुश्रद्धा, कृषाद, अम्लिका, परिधा, विष्टभ, विपाशा, ये सब हमारे को देखने को मिलते हैं. तो ये इनको जो है आज की मॉडर्न साइंस जो है ज्यादा कोई तवज्जो नहीं दे रही है, कोई ज्यादा प्रेफरेंस नहीं दे रही है. अभी हमने देखा कि उन्होंने कौन कौन सी डिसीज को देखा, बाकी सब डिसीज को नहीं देखा. लाइक वाइज एनल डिसऑर्डर्स पेशेंट को है कि नहीं है कोई नहीं पूछता है, और केवल जो कुछ मेन जो डिसीज है, डायबिटीज है, हाइपरटेंशन है, कार्डियक डिसीज है, एक्सेट्रा, HIV है, इनके बारे में देखा जा रहा है. वी कैन सी द एनोरेक्टल डिसऑर्डर्स, अगर वो कोर्स में अच्छी तरह डेवलप कर गए तो हम लोग देख सकते हैं कि ये पाइल्स है, फिस्टुला है. अदरवाइज वो प्रीडोमिनेटली हो गया है, पित्तज है, कफज है, रक्तज है, ये हम लोग देख सकते हैं, आराम से देख सकते हैं ना. और इनको डायग्नोज करने के लिए फिंगर एग्जामिनेशन, प्रोक्टोस्कोपिक एग्जामिनेशन, लोअर एंडोस्कोपिक एग्जामिनेशन, एक्सरे, अल्ट्रासोनोग्राफी, CT स्कैन, MRI वगैरह हम लोग करवाते हैं. यहाँ पर एक प्रॉब्लम आती है कि ये जो डायग्नोस्टिक प्रोक्टोस्कोपी करते हैं उसमें प्रोक्टोस्कोप डालते हैं. तो प्रोक्टोस्कोप डालने के बाद में देखते हैं हम लोग हेमोरॉइड्स, इंटरनल फिस्टुला, ओपनिंग, अल्सर, फिशर, लेकिन हम लोग ये नहीं जानते कि उसको हम रिकॉर्ड नहीं कर सकते. अगर हम करना चाहें भी तो स्केच बना के हम लोग रख देते हैं कि ये इसका गोला सा खींचा, और उसके बाद में जस्ट लाइक खींचा गोला, और उसके बाद में हम लोग कहते हैं ये दिस इज 7 o'clock, दिस इज 3 o'clock है, दिस इज 11 o'clock है, ऐसा हम लोग कर देते हैं। तो लेकिन ये प्रॉब्लम इसमें हमारे को देखने को मिलती है प्रोक्टोस्कोपी में, अदर या डिजिटल एग्जामिनेशन करने में। तो इस चीज को ध्यान में रखते हुए मैंने जो प्रोक्टोस्कोपिक डेवलपमेंट किया है, मैं उसको आपको दिखाना चाहता हूँ। मैं ये 23/2015 में मैंने अप्रैल में किया था, और मैंने उसको नाम दिया था डिजिटल प्रोक्टोस्कोपी, चोटीवाला डिजिटल प्रोक्टोस्कोपी। इसमें मैं प्रोक्टोस्कोप के साथ में कैमरा मैंने अटैच कर दिया, और उसके बाद में देखा तो वो 10 टाइम लार्जर होता है। और यहाँ पे मैं दिखा रहा हूँ इस वीडियो में कि ये इस तरह हम लोग चेक करते हैं पेशेंट को। और इससे बेनिफिट्स क्या होता है, कन्वेंशनल प्रोक्टोस्कोपी may not be remember that what हम लोग देखा कुछ पता नहीं लगता है, लेकिन डिजिटल प्रोक्टोस्कोपी के द्वारा रिकॉर्ड मूवी इमेज हम लोग लंबे समय तक, एज हमारा कंप्यूटर काम कर रहा है, हमारे पास जो नेट है वो काम कर रहा है, तब तक हम अपने पास रख सकते हैं या इमेज को दे सकते हैं। यहाँ पे मैं आपको एक वीडियो दिखाना चाह रहा हूँ। दिस इज होस्टन वाल बाय डिजिटल एंडोस्कोपी, जस्ट आपके नॉलेज के लिए। यहाँ पे ये होस्टन वाल्स दिखाई दे रहे हैं, ये रेक्टम का पोर्शन है, दिस इज होस्टन वाल posterior, and this one is anorectal junction is this one, this is anorectal junction, this is you see, this is colon of Morgani, this anal papilla patient को है। This is how anus is closed after defecation. Another video, that is, this is a case of prolapsing piles with prolapsing anterior rectal valve. Here, this is the anterior rectal valve, and these are the prolapsing piles viewing in the digital proctoscopy. This is 3 o'clock, this is 7 o'clock, and this is 11 o'clock piles. This is, you can see, these view are not visible so good with the latest modern endoscope, lower endoscope or colonoscopy, whatsoever we are doing. From that we can't see this good view. This is only possible by this Chotiwala proctoscopy. This is another video in which we are seeing this is automated anal valve, and यहाँ पे हम पैथोलॉजी कैसे डेवलप हो रही है, पेशेंट को कंप्लेंट करता है उसको ब्लीडिंग ड्यूरिंग डिफिकेशंस। यू कैन सी हाउ कैन पेशेंट फाइंड bleeding during defecations. This is the case of fissure in ano. Here, this is the point where the bleeding was there. Just sprout out just after relieving the proctoscope. So this is the method. From this we can take the various views of the pictures. This again. So this anal disorders, पेशेंट को पता होता है, लेकिन किसी दूसरे को बताता नहीं है और स्ट्रेस में रहता है। और वी नो द स्ट्रेस इज ए मेन रिस्पॉन्सिबल फॉर लोअरिंग द इम्यूनिटी। तो ये जो आज की डेट में जो कोरोना के पेशेंट्स आ रहे हैं हॉस्पिटल में, तो इनको चाहिए कि ये साथ साथ एनोरेक्टल हिस्ट्री में एनोरेक्टल डिसऑर्डर्स की भी हिस्ट्री पेशेंट की ऐड करें कि उसमें है कि नहीं। अगर ऐसा है तो निश्चित रूप से हमारे को एक और उसमें सोचना पड़ेगा कि ये पेशेंट इस तरह के ना हो। और क्योंकि हमारा जो मॉडर्न लाइफ स्टाइल है, जिसमें हम लोग देखते हैं फूड, अल्कोहल, स्मोकिंग, वैकिंग, ये सब हमारे लाइफ स्टाइल आज के जो है देखने को मिलते हैं। ये लाइफ स्टाइल में और पुराने लाइफ स्टाइल में ज्यादा कोई अंतर नहीं है। पुराने लाइफ स्टाइल में और इसमें केवल हम लोगों को जो मोबाइल और कंप्यूटर, टीवी आजकल बैठ के देख रहे हैं, और इवन देखो कि हम लोग जो कॉन्फ्रेंस कर रहे हैं ये मोबाइल और के द्वारा, कंप्यूटर के द्वारा कर रहे हैं। तो ये थोड़ा सा परिवर्तन आया है और इलेक्ट्रिसिटी की वजह से प्रॉब्लम बदलाव आया है। अदरवाइज देयर इज ऑलमोस्ट नो डिफरेंशिएशन फ्रॉम ओल्ड लाइफ, लेकिन ओल्ड लाइफ स्टाइल को हमारे आयुर्वेद ने जो लाइंस साइंस ऑफ लाइफ मैनेजमेंट ने अच्छे से ठीक कर लिया था अपनी लाइफ को। हम लोग के ये बता दिया गया था कि कब उपवास रखना है, कब आपको त्योहार मनाना है, किस तरह मनाना है, लेकिन आज की डेट में हम लोग वो सब फॉलो नहीं करते। एंशियंट जो रिचुअल्स हैं उनको फॉलो नहीं करते हैं। मॉडर्नाइजेशन के पीछे भागते भागते हम लोग बहुत सारी चीजों को खोते चले जा रहे हैं। उसका एक एग्जांपल यह है कि आज की डेट में अमेरिका में सबसे ज्यादा केस जो है हमारे को कोविड के देखने को मिल रहा है रिस्पेक्ट ऑफ इंडिया। इंडिया में रिकवरी रेट भी हाई है बिकॉज ऑफ, और कुछ हम लोगों का जो हम लोगों ने अपनी धरोहर के रूप में बचा रखा है आयुर्वेद को, उसकी वजह से हम लोग मैनेज कर पा रहे हैं। क्योंकि हमारे आयुर्वेद का उद्देश्य एम रहता है कि जो हेल्दी है उसको हेल्दी रखें और जो अनहेल्दी पर्सन है उसको उसको जो है ट्रीट करें। और इसके लिए उन्होंने पुराने आयुर्वेद के लोगों ने त्रिस्तंभ बताए थे, आहार, निद्रा, ब्रह्मचर्य, इनका पालन हम लोगों को करना चाहिए और करवाना चाहिए। साथ साथ इससे स्ट्रेस से इम्यूनिटी को स्ट्रॉन्ग करने के लिए जो एक्सरसाइज, योगा, मेडिटेशन, वो सब हमें करने चाहिए। और अगर हम लोग को लगता है कि एसिम्प्टोमेटिक है पेशेंट और मंदाग्नि आ रही है, लेकिन हमें ये भी लग रहा है कि ये एनोरेक्टल का केस हो सकता है, तो हम लोग, वो भागवत ने कहा है रोगो सर्वोपि मंदाग्नि, और इसलिए अगर मंदाग्नि अगर है और आपको लग रहा है कि एनोरेक्टल का केस हो सकता है और आपकी जांच में भी लग रहा है कि मैं आपका नहीं आ रहा है, लेकिन आपके क्लिनिकल फीचर्स बता रहे हैं, तो आप अक्सर वो रोगों कोई मंदाग्नि पर काम करते हुए अग्नितुंडीवटी या चित्रकादिवटी जो भी अग्निवर्धक है वो दे सकते हैं। और आज की डेट में जैसे कोरोना फैल रहा है, इस संदर्भ में हमें पेशेंट को एग्जामिनेशन करते समय हमें अपनी सेफ्टी और पेशेंट की सेफ्टी रखना जरूरी है। इसलिए अपनी सेफ्टी के लिए मास्क पहने, और वो अगर कोविड-19 और ये जो 95 है वो 95 वाला मास्क पहने। और साथ साथ जो नाक में, अगर आप एनोरेक्टल प्रैक्टिशनर हैं तो निश्चित रूप से आपको जरूर चाहिए कि आप नाक में अणु तेल या षडबुंद तेल या मस्टर्ड तेल या घी जो है उसमें जरूर डालें। क्योंकि अगर आप प्रोक्टोस्कोपी कर रहे हो और आपकी नाक में डायरेक्ट कॉन्टेक्ट हो जाएगा। जब मैंने जो डिजिटल प्रोक्टोस्कोपी टेक्निक डेवलप करी थी, इसी वजह से करी थी। मोस्ट ऑफ द टाइम जो है वो एकदम जैसे प्रोक्टोस्कोप डाला फाट गया सीधे मुंह पर आती है, तो उससे बचने के लिए वो टेक्निक मैंने डेवलप की। इसलिए आज की डेट में इसको ध्यान में रखते हुए, क्योंकि कोरोना के रिसर्च आ रही है कि कोरोना का जो वायरस है वो फीकल मैटर से के द्वारा भी आ सकता है, और हम बीइंग एनोरेक्टल प्रैक्टिशनर हम लोग इसके ज्यादा वल्नरेबल हो सकते हैं। इसलिए आयुर्वेद के स्टूडेंट होते हुए, आयुर्वेद के आप चिकित्सक होते हुए भी ऐसा ना करें कि उसको हल्के से लें। और कोरोना के पेशेंट अगर आप भोले भटके आपने देखे तो हो सकता है आप भी ग्रसित हो सकते हैं। इसलिए अपने आप को स्ट्रॉन्ग इम्यूनिटी रखने के लिए और ये नाक की नेजल मुकोसा को स्ट्रॉन्ग करने के लिए जो प्रोटेक्टिंग लेयर जो है बहुत जरूरी है। और साथ साथ च्यवनप्राश, हरिद्राखंड वगैरह जो हम लोग अग्निवर्धक हैं या जो इम्यूनिटी बूस्टर्स हैं उनको हम लोग जरूर लें। और इन केस आपको लगता है कि प्राइमरी स्टेज में अगर पाइल्स का पेशेंट है, जीआईटी का पेशेंट है या भगंदर का पेशेंट्स है, तो उसमें आरोग्यवर्धनी वटी, हालांकि भगंदर के केस में 400 क्लास का ट्रीटमेंट होता है, लेकिन आप उसको जीआईटी को स्लाइस करने के लिए, जीआईटी का उसको करने के लिए आप आरोग्यवर्धनी वटी दे सकते हैं। क्योंकि ये इसका जो कंपोजिशन है आप देखें, शुद्ध पारक, गंधक, लोहभस्म, अभ्रक, ताम्र, त्रिफला, शुद्ध शिलाजीत, शुद्ध गुगलू, चित्रक, कुटकी, नीम, इन सब से मिला हुआ ये बहुत अच्छा कॉम्बिनेशन है। मैं तो अपने पेशेंट को अधिकतर या आरोग्यवर्धनी वटी देता हूँ। इसी साथ साथ अगर दूसरी स्टेज में है तो आप उसको, आपको लग रहा है कि वो फर्स्ट स्टेज का है, तो आप उसको अभ्यारिज, त्रिफला चूर्ण वो आरोग्यवर्धनी के साथ में दे सकते हैं। शीर्षबात करा सकते हैं। शीर्षबात बहुत इंपॉर्टेंट है एनोरेक्टल डिसऑर्डर्स के लिए। शीर्षबात किसी सिंपल पानी में भी कर सकता है, या उसके अंदर आप टंकर डाल सकते हैं, आप यानी स्फटिका डाल सकते हैं अगर इनकेस ब्लीडिंग हो रही है, या अगर ज्यादा है तो आप पंचकल अल्कल कषाय भी आप दिलवा सकते हैं अगर वहां पे अवेलेबल हो। अदरवाइज आप प्लेन वाटर में आप उसको शीर्षबात कराएं। शीर्षबात कराने से एक तो वहाँ का सर्कुलेशन अच्छा होता है, दूसरे क्या होता है जो पाइल्स होते हैं वो श्रिंक करने में उनको मदद मिलती है। अगर भगंदर है तो उसका वुंड हीलिंग में मदद मिलती है, पेन में मदद मिलती है। अगर किसी को जैसे फिशर का पेशेंट आ रहे हैं या हमारे पास फिशर के पेन आ रहे हैं पेशेंट आते हैं, तो उनको विशेष रूप से ध्यान में उनको प्रॉब्लम होती है कि वो 3-3 4-4 घंटे तक जो है उनको पेन होता रहता है। तो ऐसी कंडीशन में अगर आपके पास पेशेंट आता है तो आप क्या करेंगे उस पर? सिंपली अगर उसको ये कहिएगा कि वो जस्ट लैट्रिन कराने के तुरंत बाद जो है उस पर प्लास्टिक के तसले में पानी डाल के बैठ जाए, गर्म पानी में, जस्ट बाद, मतलब उधर से उसने उसको शौच किया, धोया और धोने के बाद में तसले में बैठ जाए। नहीं तो अगर वो वेट करता है 15-20 मिनट का बात करता है, गर्म करता है, तो उसको उतना रिलीफ नहीं मिलता, बिकॉज जैसे ही आपको लैट्रिन करता है तो उसके बाद में इंस्पिक्टर थोड़े रिलैक्स रहते हैं, और इस रिलैक्स कंडीशंस में वहां पर वाटर जो जाएगा, गर्म पानी जाएगा, तो उसके पेन सब्सटेंस जो प्रोड्यूस हुए हैं स्ट्रेच के द्वारा वो सारे वॉश आउट हो जाएंगे और वो पेशेंट को पेन में आराम मिल जाएगा केवल सिंपल सीड्स बात से। उसके साथ में क्योंकि उसमें वुंड होता है फिशर में, तो मैं एडवाइस करता हूँ पेशेंट को अपने जात्यादि घृत जो है वो बहुत अच्छा वुंड हीलर भी है और पेन मैनेजमेंट भी काम करता है। तो इसके साथ साथ अगर इन्फेक्शन की संभावना है तो मैं अर्श कुठार को प्रेफरेंस देता हूँ। अर्श कुठार का भी कॉम्बिनेशन आरोग्यवर्धनी बटी की तरह ही बहुत अच्छा है, जिसमें रस है, शुद्ध गंधक है, लोहभस्म, अभ्रक, बेल, अग्नि, वसना, मरीच, दंती, टंकण, जव, सेंधव, गोमूत्र और सुनई क्षीर। तो ये कॉम्बिनेशन से मैं अर्श के पेशेंट्स को, भगंदर के पेशेंट्स को, ऑफिसर्स के पेशेंट्स को मैं ट्रीट करने का प्रयास करता हूँ और अच्छे रिजल्ट्स मिलते हैं। इसी साथ साथ और कोई मैनेजमेंट में आप वुंड हीलर्स के लिए जैसे त्रिफला गूगल हम लोग भगंदर में देते हैं, और इसमें क्या कहते हैं फिशर में देते हैं, सप्तविशति गूगल फिशर में, भगंदर में, और जो सब फिशर में इन दोनों के साथ साथ मैं जस्टी मधु जरूर देने की कोशिश करता हूँ, ताकि वो वुंड हीलिंग भी करे और पेन को भी रिड्यूस करे। और इनकेस ब्लीडिंग हो रही है तो ब्लीडिंग होने के लिए जैसे रक्त स्तंभक बदी है या और भी आपके पास है वो आप दे सकते हो। काशी सादी तेल जो है, अगर पेशेंट को ब्लीडिंग होती है तो मैं प्रेफर करता हूँ कि काशी सादी तेल 10 ml उसको 2 बार 3 बार जो है डलवाने के लिए, जस्ट सिर्स बात किया उसमें और सिकाई करने के बाद में उसको काशी सादी तेल 10 ml उसको डलवाने के लिए मैं कहता हूँ। तो इससे जो है 1-2 दिन के अंदर ही ब्लीडिंग उसकी पेशेंट की कम हो जाती है। अगर इनकेस जरूरत पड़ती है आप रक्तमोक्षण भी जैसे भगंदर में हम लोग करवा देते हैं, या अगर कोई पेशेंट को कोलाइटिस है तो आप उसमें बिलवादी चूर्ण दे सकते हैं, बिलादी या बिल के कोई भी कॉम्बिनेशन जो आ रहे हैं वो आप दे सकते हैं। और हम लोग क्षार कर्म करते हैं, अग्निकर्म और शस्त्रकर्म जो सर्जिकल प्रोसीजर्स हैं, इनकी डिटेल्स तो फिर कभी सर्जरी के मौका होगा तो उसमें बताया जाएगा। आज के लिए मैंने इतना ही रखा था, और इसी के साथ सभी सुखी रहे, सभी निरोग रहे, इसके लिए साथ ही मैं सबको आप सबको धन्यवाद देता हूँ। थैंक यू।
Thank you, sir.
Thank you.
Now we will discuss regarding questions. There are a lot of questions for madam because of, I think, this COVID and all these things.
You are going to ask, or I should read?
Yes, I will ask, madam.
Okay,
You can give
yeah.
answer. Madam, in classic also they have mentioned Tamaketu Virachanam. Then, is there any specific reason for more people are not comfortable with woman procedure?
Yeah, Vaman procedure is difficult, so I'm not following Vaman. Sadhya Vaman is because of Kaphotlesha. When they have very difficulty, because once we start giving this, as I mentioned, Tikshna, Ushna, Dravyas, that Kapha, whatever is accumulated, that start dissolving. When and they get severe cough, that time that's Utklesha is there. It's very easy. Just by anything stimulation, they'll just vomit. That's what I give Sadhya Vaman, not the Vamana Karma. Vamana Karma is let's say Uras and Kafasthana. It's also mentioned. Virechana I have given and I have found the result. But Sadhya Vamana is just to give them relief. I think I got the point.
Another one is question from Dr. Nanda Pai. What can be administered in allergic rhinitis due to rain?
Allergic rhinitis, mostly I give Lagusut Shekaras with the Haridra Khanda, and Amapachana is also very important because allergic is there is some disturbance in Agni. So with the Amapachana, some Amapachana dravyas, you can give these more Haridra and this Baricha, these kind of drugs are better. I find better in these conditions. Even Nardiya Lakshmi Vilas also helped in this.
Okay, sir, proctoscope regarding which you were talking, I is it available for doctors in market?
नहीं
Which
अभी
one?
नहीं है. It is
नहीं.
undergoing research now.
Okay.
हाँ.
So it is right now it is not available.
ना ना अभी नहीं. अंडर रिसर्च, क्योंकि बहुत सारी चीजें इसमें भी होनी है, तो अंडर रिसर्च है.
No problem, sir.
इसकी ये जो इनोवेशन है, इसका प्रेजेंटेशन जरूर लोगों को मैं बता रहा था, ताकि लोगों को, हमारे स्टूडेंट्स को, जो डॉक्टर्स हैं, उनको पता रहे कि आयुर्वेद में हम लोग ये कर रहे हैं, क्योंकि लोगों को पता ही नहीं रहता कि आयुर्वेद में बहुत ज्यादा कुछ हुआ है या साइंस. आज की डेट में लोग ताने कसते हैं कि आप तो पुरानी चीजें बताते चले जाते हो और नया कुछ बताइए. तो नया तो यही है, सबसे लेटेस्ट है जो हमने आपको दिखाया है. और ये मैंने अभी आपको वो वाली वीडियो नहीं दिखा, इसमें शेयर करी है, जो मैंने फर्स्ट टाइम ली थी, और मैंने उसको यूट्यूब पे डाल रखा है. दैट वाज द फर्स्ट वर्ल्ड, आई थिंक वर्ल्ड की फर्स्ट मूवी थी जो मैंने डाली थी.
Okay, no problem. Question for madam.
Yes.
What do you use for Sadhya for children and adults?
No, for children, mostly I don't suggest anything because they are not comfortable. So when they have severe cough and they could feel the phlegm in the throat, I tell them to do this Lavana Taila Abhyanga. It should be warm taila and a little fermentation by hot water bottle or a hot bag, and then ask them to put some catheter or through their last finger just to insert into the mouth. They'll just vomit. That's all. I don't give because they are small and they're really scared. After they would have gone many times to the hospital before coming to me. So this is the one. This works well. I've seen in many cases.
For sir, one question is there. Sir,
Yeah.
many get surgery for piles, but after few years they again gain piles. So what is the main reason for its reappearance?
हाँ, क्या मैं स्लाइड दिखा सकता हूँ?
हाँ sir, no problems. You can.
In this slide, in the pink color, you see the स्त्री प्रसंग. इसको कोई बंद नहीं करता, इसको कोई बंद नहीं करता. उत्कटासन, प्रस्थियान ये बंद हो सकते हैं कुछ समय को, लेकिन स्त्री प्रसंग जो है ये बंद नहीं करता. और इसका जो फैक्टर है, ये जो इस रिंग के ऊपर जो स्पेक्टर्स जो होते हैं ड्यूरिंग sexual activities, these inspectors are tightly closed. Because of that, this mucosa is ischemia is there, and again that process is start. And so that after a few years, patient get again the piles. If patient does not do such nidanas, then it is not necessary that they will come reappear. I think
sir, along with the sexual activity, there may be other factors also contributing for this reappearance of piles.
नहीं वो है खाने के लिए है, लेकिन क्या है कि जो इंस्पेक्टर्स के ऊपर जो काम कर रहा है, वो आपका जो खाने का चीज है, जैसे वो कीचड़ वगैरह खा रहा है, तो वो रेक्टम की मुकोसा भी जा रहा है, रेक्टम की मुकोसा को इरिटेट कर रहा है. लेकिन पाइल्स जो एनल मुकोसा जो है, वो जो सीमा डेवलप कर रहा है, वो दैट इज स्फिक्टर्स, इंटरनल स्फिक्टर्स एंड देन एक्सटर्नल स्फिक्टर्स टाइटली क्लोज हो जाते हैं ड्यूरिंग द सेक्सुअल एक्टिविटीज, and because of that the ischemia is there.
Sir, what is your experience regarding prevalence of piles in male and female?
It is previous slide में मैंने बताया 2:1, मेल में ज्यादा होता है, फीमेल में कम होता है. वो इसी वजह से होता है।
Okay.
मेल में ज्यादा होता है क्योंकि उसको सीमन को डिस्चार्ज करना होता है, बिकॉज ऑफ दैट।
Okay.
एनीथिंग एल्स?
Madam, for you, one question. What is the quantity of fund for women should be given? Question by Dr. Madhu Sudana.
I give 1 liter of water with I just make I mean, tell them to make font of almost 80 to 100 grams of this yashti madhu, and let just put it in the boiling water and switch it off, leave it for some time. So usually they do it at night, or if they leave it for longer duration, I think it works faster. So this has given the good results. 1 liter I tell them to consume. Some people start throwing up before that. Some people they need 1 liter full.
Madam, what is your experience with this Sri Dutta Papeshwar Limited's Kasa Swasa Harirasa in this COVID or
Yeah, that
Tamakshwas?
is yeah, it's a very good medicine, because I usually start first, I give all Kaphavata Shamaka and all that, then I start Rasayana. As a Rasayana, this is very good. And many people, I tell them to stop after some time. They're scared to stop because they enjoy the this tablet. So they come, and some of them I have to send to that, like my abroad patients. They feel if they stop, I tell them it's you're fine, no problem, you don't have to take. But still they feel like taking. I don't know something will happen or not, because all Rasaushadis, but still they feel good digestion. They feel very energetic. That is the main thing. They say the word energetic. So this one helped a lot. Kasashwas Hariras. I know
Uh,
Mr. Panduranga Holla and
yes, yes, yes.
these people, they know I write a lot.
Okay, okay, okay. I think somewhere in your deliberation you explained regarding Kasa Swasa Harirasa. I think it is a unique combination, because you were telling regarding there are many people, they do not want to they are not ready to take more medicines. So I think it's
Yes,
a
yes,
combination for at one place you will get a lot of things, lot of ingredients.
yes.
Sir, uh, for you one question: line of treatment for dry cough.
Dry cough, yeah. If there is sometimes dry cough is due to some acidity, we should differentiate, because many times we start giving Kasahara line of treatment and we increase the body heat and acidity increases because of that is Urdhvagati of this maybe Amla Pitta or something. So that if it is because of Pitta, we have to give Pitta line of treatment, Kamaduga Rasa or Madhuyashti. Madhuyashti is one which helps in Vataja and Pittaja Kasa. So Madhuyashti can be given, and Haridra Khanda if it is allergic, and even this Salisadi tablet, as I told earlier, you can chew it, and that will help. And depending on the condition, that mostly the reason will be somewhere else. Even I have seen patients with the different medications, heterogenic with the BP medicines and different medicines, they are getting dry cough. By changing we tell them to change the medicine, the dry cough stops. So Haridra Khanda will also help. So.
Okay. Madam, for you, what is your insight for this COVID condition and Ayurvedic medicine?
COVID condition, I am working on it for last 3 months. Many people know in Bangalore. I have
Mhm.
even contacted our ministers also. I feel we have better, we can treat better. If they start giving our immunity, our drugs like we have several drugs. So if they start giving to everyone, definitely wherever the condition is bad, we can circulate there, and they don't get the new cases. On this, I'm working. Even I'm giving this. Pradhamana Nasya from Shunti Churna. I've circulated more than 3,000 packets of that from Loka Ayurved, Gujarat. I represent Karnataka state. So I'm working on it, but I'm not finding a result as I expected. That is the problem here.
Sir, do you have any categorization for first grade, second grade, third grade price where you are recommending operation?
Third and fourth.
Third and fourth. Okay. So how ordinary people can avoid piles like a situation? What is your guideline regarding it?
मेरे को ये कहना होता है कि एक तो सेक्सुअल एक्टिविटीज कम से कम करें फर्स्ट, बिकॉज उसकी वजह से ज़्यादा हमने देखने को मिलता है. दूसरे मिर्च मसाले वगैरह जो होते हैं वो कम से कम खाएं. है ना। जो आयुर्वेद में बताया गया है ना, वो निदान को जो परिवर्तन करता है, तो दैट इज सफिशिएंट फॉर यू। और इवन जो है अगर 4th ग्रेड को ट्रीट करते हैं, तो वो 3rd ग्रेड में 3rd वाला, 2 में 2 वाला, 1 में 1 वाला जो है 0 हो सकता है ना। ऐसे मेरे को देखने को मिला है। जैसे हम लोग शीर्ष बात वगैरह करते हैं पेशेंट को, तो शीर्ष बात करने से जो फाइल्स हैं उसका साइज श्रिंक हो जाता है। अगर पथ्य लेता रहता है, निदान का परिवर्तन रहता है, तो श्रिंक करते हैं नेचुरल सिस्टम। और मोस्ट ऑफ द टाइम हम अवॉइड करते हैं कि तुम सर्जरी ना करो ना। सर्जरी के लिए हम लोग ज्यादा वो नहीं करते, कोशिश करते हैं पेशेंट को जो है वो इससे अगर हम ठीक हो।
ओनली वो जो साइज वो श्रिंक हो जाता है, कंप्लीटली डिसअपीयर भी होता है आई थिंक कभी।
कंप्लीटली तो नहीं, सिर्फ बहुत अगर लंबे समय तक करता रहेगा, लेकिन वो इतना कर नहीं पाते कोई।
ओके, सो ओनली फॉर सिर्फ श्रिंक हो जाता है, राइट?
हाँ।
I think there are no more questions. So
yeah, one question I can see, I think this regarding this Taila. Yes,
okay.
Karpura Taila can be used. I have given it to some of my patients, because most of the time they call me emergency in the evening or night from home. So I can't send them the Karpura Taila or whatever. You can use Karpura along with Taila, and also Lavana can also help them. This question I can see.
Okay. Satish, can we conclude this session?
Yes, Dr. Abhijit.
Okay, Madam and Sir, I'm really thankful for both of you. Very insightful, very nice session. Something different we learned today from both of you. Along with that, I also thankful to Dr. Satish. Thanks to all Vaidyas who joined by Zoom. As well as you can visit www.sdlindia.com website to know more about products. If you have any query or suggestion, you can contact us on healthcare@sdlindia.com. Stay tuned with us as we are one more webinar, means we are already in a webinar session, so you will be able to see, you will be able to watch or understood a lot of things from the webinars in coming days. Till then, stay safe and stay healthy. जय धन्वंतरी, जय आयुर्वेद, जय श्री धूतपापेश्वर महाराज. धन्यवाद to all speakers.
Thank you very much.
Thank you. Thank you, madam. Thank you, sir.
Thank you.